So welcome to September's TCCI Work Health and Safety Business Briefing. My name is Lauren Kerrison and I'm the Work Health and Safety Facilitator for the Tasmanian Chamber of Commerce and Industry. I will be facilitating today's session. I ask that everyone is on mute, which I believe everybody is. I can't hear any background noise. And if you have any questions, please feel free to put it in the chat, and I will collect them at the end and we'll go through any questions that you have for Adam, or you can put yourself off mute and ask at the end as well. Today's session will cover ISO 45003, Psychological Health and Safety at Work. In 2021, the ISO released the first international standard for psychological health and safety at work, the ISO 45003. In this session, Adam will provide a high level of what a psychosocial hazard is and how the ISO standard can be used to help guide the assessment and control of the psychosocial hazards, and how his research, specifically using implementation science, will ensure implementation efforts are successful. So I will now hand over to Adam Nebbs to introduce himself and commence today's session. Thank you.
Thanks, Lauren. Thank you so much, everyone, for joining. It was great to see we had maximum registrations for this, so hopefully we have maximum attendance as well. So my name's Adam Nebbs. I'm a early career and lived experience researcher at the Menzies Institute for Medical Research, and the title of today's talk is Preventing Harm to Employee Mental Health Through Psychosocial Risk Assessment and Control, a case study of ISO 45003 implementation. I just want to say a big thank you to some people that aren't on the call today, which is Professor Angela Martin, who's my primary supervisor and the chief investigator on this particular project, as well as Associate Professor Amanda Neal, Dr. Sarah Dawkins, and Dr. Jessica Roydhouse. So obviously, as you can see in research, there's quite a few different experts in this field that are kind of working on this with me. Before we get into the content, I just want to do an acknowledgement of country and just say that we acknowledge the Palawa Pakana of Lutruwita, the traditional owners of the land upon which we live and work. We pay respects to elders past and present as the knowledge holders and sharers. We honour their strong culture and knowledges as vital to the self-determination, well-being and resilience of their communities. We stand for a future that profoundly respects and acknowledges Aboriginal perspectives, culture, language and history. So I just want to preface that if you're at the WorkSafe conference that was back in July, I think now, there will be quite a few similarities to this presentation, although I have a few more specific and more recent examples. So sorry if there's obviously some duplication here, but nonetheless, psychosocial hazards and risks is quite a complex topic. So I think kind of embedding the points that I made at the WorkSafe conference is a good way anyways. So I want to start with a quote from American psychologist Frederick Herzberg, and I'm sure many of you have heard me say this before. If you want people to do a good job, give them a good job to do, an enriched job. And he said that back in 1984 in Randall B. Dunham's Organizational Behavior, People and Processes in Management. And I would get us to reflect 38 years on from that quote, have we actually created good jobs? And I'd say that we've really forgotten the importance of creating good work. And I do want to provide some examples now of, or some extreme examples of jobs that we've created that haven't been great. Before I provide those examples, though, I just want us to reflect on something that's happening right now. At the moment, schools across Tasmania are closed, and that's because obviously of union action, and teachers are frustrated with the jobs that they have at the moment, their working conditions, how they're being rewarded and compensated for the work they do. So, you know, what better than a live example that's happening and impacting obviously us and our children right now, because we haven't got this right. We haven't created good jobs. So it's quite rare, I think, that we're in a situation where you have a live example. So I just wanted to really get us to reflect on that and how important it is. So these are some extreme examples. The first one is about Amazon employees are burnt out and leaving their jobs. And so this was from back in January. What you can see underneath that is a meditation booth that they started to put in their warehouses during the time of COVID. And obviously we can all appreciate we're all in lockdown. So obviously the amount of Amazon packages going out into the world increased substantially, and with it, the job demands and the stresses put on those warehouse workers. So that was one strategy that you would have probably seen floating around on LinkedIn, which was to create these meditation booths that the workers in the warehouses could have gone into if they're feeling stressed. Another example, this is an older one. Japanese woman dies from overwork after logging 159 hours. And this is part of a cultural phenomenon that happened in Japan called koroshi, or death from overwork. And as I said at the WorkSafe conference, I want to acknowledge, I think the Japanese government have taken some great steps to kind of mitigate these things. But where you can see underneath this title is a standing sleeping bed, which some workplaces used to kind of help their workers who were logging significant volumes of hours, that they could go into these standing sleeping booths and sleep. Now, that was better, as I said at the WorkSafe conference, than the alternative, which was before this, the workers were actually going into the toilet cubicles and sleeping in there. So obviously it's a step up from that, but nonetheless, this overwork culture, this kind of focus on individualized controls and getting people to, go into standing sleeping beds, probably not a great approach to take. On the left, we've got a really sad example, a very recent unfolding example from Ernst & Young. There was a suicide there. And what we're finding now is a lot of information is unfolding about sexual discrimination and bullying claims. And they've actually got an expert, Elizabeth Broderick, to review the bullying claims that were coming out of EY. And it's quite scary to think, obviously, that a big consulting firm like that would obviously have something like this unfolding. So that's quite a sad example. And ties in as well, very, very soon, employees are going to have a duty to take reasonable and proportionate measures to eliminate sex discrimination, sexual harassment, and victimization with some new legislation that's going to be introduced. This was actually taken out of the Respect at Work report that was kind of undertaken last year. So it's great to see that there will be some legislation, I suppose, unfolding in that sexual harassment space. And on the right, we have French CEO sent to prison after his policies resulted in the deaths of 35 employees by suicide. And could that be a more stark, shocking example of how workplace policies and not creating good jobs can lead to horrible outcomes such as suicide? So these are really horrible examples and things I'm sure that would make Frederick Herzberg cringe. I want us to reflect, though, and think about our own examples and lived experiences of work and the lived experiences of the work that our loved ones and our friends and family do on a daily basis. Would you say we have good jobs? And I can say from my own circle and my previous experiences in work, the jobs haven't been great. They're just jobs that we almost try and get through on a day-by-day basis, but they're not great jobs. So we really need to focus on how we can improve job conditions. One other thing in the slide that I want us to focus on is just the meditation booth and the stand-up sleeping beds. And I've talked about them briefly already. But what you can see there is workplaces that are acknowledging that the workplace environment is stressful, or that the job demands are so substantial that people have to log substantial hours that are, in some extreme cases, well above their capacity. But you can see them taking control measures here that shift the responsibility of that problem onto the workers. And that says, if you're stressed, you should go into this mindfulness booth and meditate. Or if you're tired from the workloads that we're giving you, you should go and sleep. And I really want us to really think for a moment. This is how a lot of these control measures or interventions have been put in place for a long time. It shifts the responsibility of stressful working conditions to the worker, and we need to focus more on changing the work conditions. And I really want to hone in on that point to say this is a joint responsibility. The employers have the responsibility to create work that's safe from physical and psychological harm. That's in the regulations, it's in the Fair Work Act, the Anti-Discrimination Act. But your workers also have a responsibility to look after their own mental health. As I said when I introduced myself, I have a lived experience of ADHD, and I need to take steps to look after my own mental health and ensure that my neurodiversity doesn't stand in the way of the work that I need to do on a daily basis. So it's a joint responsibility, but for too long, we've really focused on individual responsibility for mental health. So now that we've kind of talked about bad jobs, I suppose, let's talk about what a good job is. And so I'm going to take this definition from the Australian Institute of Health and Safety. I think it's a really good definition. And they say that a good job is about creating healthy and safe work where hazards and risks are eliminated or minimized so far as reasonably practicable, as well as striving to optimize human performance, job satisfaction, and productivity through the design and management of work and by promoting relationships between people at work which are productive and respectful. So you can see the elements of good work seeping in here. That, the example from Ernst & Young was clearly one where we weren't creating respectful relationships in the workplace. We weren't managing conditions such as burnout and substantial logging of hours. These are things that we need to do that were absent from those jobs and meant they weren't good work. As well as good work is about rewarding workers' efforts fairly and providing all entitlements following Australian employment laws. So we can see that in the live example happening now with teachers. They want to be rewarded for their efforts fairly. So again, all these examples come into the fact that we're not creating good jobs. So yeah, since the 1980s and since that quote from Herzberg, there's been less emphasis on the importance of creating good jobs. It's really shifted the focus to the individual worker and placing the responsibility on them. Two other examples, I suppose, relate, and I talked about these at the WorkSafe conference, so sorry again if these have been duplicated. You may have seen the graphic on the left floating around on LinkedIn, and this is from the TV show Friends. And this is a scene where you have Phoebe on the left is teaching Joey on the right how to speak French. And every single time she speaks French, he repeats something back to her that's completely different. And the idea here is that Phoebe represents the employee who's saying reduce employee workloads. And Joey represents the organization, and he's responding by saying, well, I'll provide you with a mental health webinar instead. Now, obviously, I can appreciate the irony that we're on a mental health webinar now. So I'm not saying that, we should just stop all mental health webinars, but I'm really trying to get us to focus on the fact that quite often when we consult with our employees, they're asking us to modify the work that we do, and we respond by providing them with a mental health webinar. And the same can be seen in this TikTok video that was trending, which is HR in 2022. And this is, due to the job demands that were created by COVID. And in this video, you see the HR worker here talking to workers and saying, look, we appreciate that you're stressed. We're going to take some swift action to help you. And the workers respond with similar things to the Friends example, saying, reduce my workloads. Are you going to provide us with increase in pay or breaks? And the response is no, we'll provide you with a mental health webinar. So what I'm really trying to hone in on there is the fact that too often we focus on shifting the responsibility to the worker and saying we've provided you with an awareness of mental health in the workplace, and so we've met our due diligence there, and that's just not the case. So just an agenda now of what I want to cover with the rest of this presentation. Firstly, I want to talk through what is psychosocial risk and why should we manage it. Provide an overview of the ISO 45003 and how it can be used to manage psychosocial risk. And talk about our implementation research that we're doing. And it was great. I saw one of my colleagues, Kelly McInnes, actually join this presentation, who's been working on this project with me. So it's great to see Kelly there as well. So thanks for joining. So what is psychosocial risk? Well, to answer this question, we first need to look at what is a psychosocial hazard. And what you can see there is a great graphic that was actually produced by Safe Work Australia really recently, which is what psychosocial hazards sound like at work. Because it's very easy, I suppose, to see what physical hazards look like, but psychosocial hazards are quite complex. And what this graphic's trying to do, and I'm happy to share this with anyone, but there's a link there in the slide. These are the kind of things that you would hear from your workers that could be signs that there are psychosocial hazards present in your workplace. And what's really great is over the past few months, Safe Work Australia have amended the model work health and safety regulations to include psychosocial hazards. They've released a model code of practice in August. We can already see states like New South Wales adopting those changes into their own regulations. As for Tasmania, we're still going to see how this unfolds, but obviously as one of the states that's under the harmonised model laws, it's very likely that those regulations are going to be updated and consistent with model law. So a psychosocial hazard as defined in the model work health and safety regulations is a hazard that A, arises from or relates to the design or management of work or a work environment or plant at the workplace, or workplace interactions and behaviours, and B, may cause psychological harm, whether or not it may also cause physical harm. So that's literally in our model work health and safety regulations right now, and it's an expectation that we start to manage these things. So obviously, as with physical hazards, the psychosocial risk is a risk to the health and safety of a worker or other person arising from a psychosocial hazard. So it's the same kind of process that we'll be talking through here as you would take from a physical health and safety perspective. So some known psychosocial hazards include high or very low job demands, low job control, or supervisor and co-worker support, and poorly managed change. And that's taken from the 2019 guidance from Safe Work Australia. So there's many resources out there, and I really encourage you to consult with WorkSafe Tasmania as well as Safe Work Australia as well. It is important to note, though, that psychosocial hazards are complex and multifaceted, and they frequently interact with each other as well as other physical hazards in the workplace. So we need to consider how these hazards interact so as not to underestimate their impact. And so some of the initial conversations I've had with the organisations we're working with in our implementation study are that Safe Work Australia has done a great job in helping you to understand what the known psychosocial hazards are, but you need to take those steps to understand what are the unique psychosocial hazards in your business, because if you miss those out of your risk assessment, again, you might not understand the complexity of how these components interact and the impact that they will have. So when psychosocial hazards are not effectively managed, this increases the risk to psychological health and or physical injury and illness. And what's really good timing is my primary supervisor, Angela Martin, and I will be releasing a white paper tomorrow at the Mind Games event. Some of you may be familiar with the Mind Games. And that really covers a lot of these things around what is a psychosocial hazard, how can you create good work, what does good leadership and commitment look like. So at the end of this, I'll provide my contact details. So if anyone would like a copy of the white paper when it's released, more than happy to share that with you as well. So why manage psychosocial risk? Obviously, you know, we've got people on this call who probably already understand the reason why. So I won't labor this point too much, but I do want to just provide some important statistics. So the latest workers' compensation data from Safe Work Australia shows that the median time lost for mental health conditions is 26.6 weeks. And that's significantly higher than any other injury or disease and has increased by 138% since 2000 to 2001. The same report shows that the median compensation paid for mental stress claims is $46,400, which again is substantially higher than any other injury or disease and has increased by 221% since 2000 to 2001. A report from the Productivity Commission as well, and this is from back in 2020, showed that workplace absenteeism, which is the inability to go to work, and workplace presenteeism, which is the inability to fully function at work, caused by mental ill health, cost the Australian economy between $13 billion to $17 billion per year. So it's a huge cost expense. But if we flip it as well, in addition to saving money, if you are managing psychosocial risks appropriately, this will help you to retain talent within your organization. And that talent's going to want to provide extra discretionary effort in the good work that they do. And we've probably heard of things such as the Great Resignation, the concept of quiet quitting. Obviously, employers are struggling to retain talent now because people want good jobs to go to. So if you start to manage these things, you're going to be one of those employers with a good job, and you're going to not see things like quiet quitting and things popping up. So we'll just go through a bit of an overview of the ISO 45003 standard now. But just to unpack what the International Organizations for Standardizations, or ISO, is, for anyone who doesn't know. So the ISO is an international standard setting body that was founded back in 1947, and they're the largest standard setting body in the world with over 160 national members. The ISO 45003 was published in June 2021, and it's the first global standard for psychological health and safety at work. And you can actually obtain a free read-only copy on the ISO website through this link that I've got here, because I had a lot of people asking me for that at the WorkSafe conference. And once you click on that link, there is a read-only copy that you can consult as well, or some links to where you can actually purchase the standard if you want a hard copy. So the ISO 45003 is a guideline for managing psychosocial risks at work within an occupational health and safety system. And that's what I love about this standard. We're no longer seeing mental health as a nice to have. This is putting it down as a safety prerogative and saying you need to manage these things exactly the same way that you manage physical hazards in the workplace. This standard as well was developed by the same technical committee who developed the ISO 45001 standard. So we may be more familiar with that because that's been out since 2018 now. And that is a standard that provides guidance around how to create occupational health and safety management systems. And if anyone's not familiar with the ISO 45001, that was previously known as the WHS AS 1801. So sorry for all the technical designations, but this is the world of standards for you. So it's also important to note too that the ISO 45003 is a type B or child standard. So the idea of this is that you use this standard along with the ISO 45001 to manage psychosocial risks through an OH&S management system. Now, just to clarify, there is no formal certification for this. Obviously, you can be certified in the ISO 45001. There is no formal certification for this standard because it is a type B or child standard. However, the British Standards Institute have advised they will be doing an unaccredited certification. So if you do want to receive that, that's an opportunity for you as well. What's important too is the ISO 45003 helps organizations achieve 7 of the United Nations Sustainable Development Goals, which you can see here, which is good health and well-being, gender equality, sustainable cities and communities. So it ties in specifically to those sustainable development goals. And it should also help you meet the S or the social and ESG. So if that's a really high priority, obviously for your organization, this is a good means of meeting that. Before you begin though, I really want us to think about, are you ready to implement this? And these are the conversations that Kelly, Ange, and myself are having with organizations right now, because you don't want to rush to try and implement something when you haven't actually considered whether your workplace is ready. So the ISO 45003 should be used to manage psychosocial risks in the same way you manage physical risks in your organization. And implementing this should help you achieve the expectations that are set out in the recently amended Work Health and Safety Regulations and in the Model Code of Practice. And like any ISO standard, it has 10 clauses that fit within a Plan, Do, Check, Act or PDCA framework. However, I believe there really is a pre-planning phase before this because of the complexity of this topic. So in this pre-planning phase, and this is what we're doing as part of our implementation research, you should look to form a team of key organizational stakeholders, and that could look differently for every organization. It could be people working in work health and safety, HR professionals, business transformation professionals, and with every organization that we speak to, some of these roles cross over and things like that as well. But it's about getting those key organizational stakeholders that should have a voice, at that leadership level when it comes to psychological health and safety at work. And it's about getting that group together to focus on, do we have the right competence in understanding what psychological health and safety is? A lot of this language is really quite complicated. We haven't made it easier. We haven't made it easy for people to understand potentially what psychosocial hazards and risks are. So I think it's a really important step to sit down and understand what is your competence when it comes to mental health, psychosocial hazards, and these components in general. So in addition to that, and after you've kind of obtained that bench line of what your knowledge and competency is, that's where you can take action to say, do we need to get some training or go through and, do some knowledge building exercises before we start to try and implement this? I'd also get you to ask yourself, do we have an OH&S system that is set up based on best practice, like the ISO 45001? And I can say from some of the discussions that I've had with organizations in Tassie, some organizations have an OH&S management system that isn't based on best practice. It's just something that's always been there, and they can't clearly link it to a best practice standard. So that's something you want to reflect on too. Do we have a best practice OH&S management system? Do we have clear visibility of the scope of that system? We want to consider these questions before we start getting into the nitty-gritty of psychological health and safety. Finally, as well, consider whether your organisation is ready to implement a change like this. So we actually use a readiness assessment with the organisations we're working with. It's called the Organisational Readiness for Implementing Change measure. And it looks at two areas, which is, are you committed to change? So are you willing to do whatever it takes and to overcome the barriers that could come with this? Because it's not necessarily going to be an easy thing based on how we've managed this in the past. And also, are you ready to implement this change? Do you have the resources, the personnel, the leadership will to do so? And as I said before, it's really important here because there's going to be a lot of cynicism from your workers. And this is because we've really focused this on shifting the responsibility of mental health to the workers. So, of course, as soon as you start talking about initiatives in this area, they're going to think that the responsibility will be placed at their feet. I want us to consider as well, if you have workers who've been bullied or have experienced incivility in the workplace or have potentially experienced poor organisational justice, those people are going to be very hesitant to want to get on board or to contribute or consult with you around this. So you really need to do this pre-planning to understand, okay, well, how are we going to reach those people? Because they're going to ultimately be instrumental in shaping how this strategy looks. So how can we use the ISO 45003 to manage psychosocial risk? So once you work through this pre-planning phase, you can move into the planning stage, which is clauses 4 through 7. And this is where you should spend the bulk of your time. Now, every organisation is different, whether you're small, medium or large, you're going to vary your approach here. But a good strategy, as I said, would be to set up a working group and start discussing the internal and external factors unique to your workplace. And you want to do this to understand, are there factors that are going to help to facilitate this change? But are there also factors that might stand in the way of our OH&S objectives? And that can be a good moment for you to reflect on your objectives around your physical safety measures as well. And after discussing the internal and external issues, you want to consider the needs and expectations of your workers and other interested parties. And when you're having this conversation, this is where you can think about, well, what are our current legal obligations, whether it's fair work, anti-discrimination, the work health and safety regulations, which of these needs are actually legal expectations now? And are we actually meeting those expectations, or do we need to take further action? At this point, because we're really having a higher level discussion at a leadership level, it would also be good to bring in some workers and worker representatives, because you want to help reconcile whether everything you've captured during this leadership discussion is consistent with how workers would see it. And it's important to consider that as well, that psychosocial hazards are not as well known as physical hazards. So you may need to build competence in your workers first, or initially draw on workers who might have a high level of mental health literacy or some level of experience in relation to psychosocial hazard and risk. After identifying issues unique to your workplace and their priority, it's about developing the right approach to consulting all of your workers. And this could be through a psychosocial risk assessment like the People at Work tool. But I would really encourage, and these are the conversations I've had with organisations so far, make sure you find the right tool or measure to suit your unique context. Because People at Work, for example, is going to cover a lot of the key components and known hazards. But again, we're trying to get at those specific unique hazards in your workplace. So again, you might need to lean on some expertise or consult with some experts in that area to understand what tools are available. But nonetheless, if you're doing something like People at Work, that's a really great start in kind of managing these known risks. So the do phase, clause 8, is about implementing the controls required to manage the psychosocial hazards you identified during the planning phase. And the good thing about the ISO 45003 standard is it has a list of controls that can be matched with the hazards that you identify during that risk assessment. Otherwise, it is suggested that you seek organisational experts, whether it's a professional or consultant, to help you kind of workshop some ideas that you might have. It's important to note as well that the list of hazards and controls in the standard are not exhaustive, and you need to consider what hazards are also unique to your organisation. At the moment, there is a lot of work going on at a national level to create good job level controls to address these, because this is what's been absent for a long time, the job level controls. But the good thing is, obviously, with all these updates to legislation, there is, more emphasis and more money being poured into these initiatives as well. So the check phase, clause 9, and the act phase, clause 10, outline the steps that organisations should take once controls are in place, such as monitoring their effectiveness, reporting non-conformity, and creating a culture of continuous improvement. So this is all stuff that you would normally manage in a good OH&S management system from a physical health and safety perspective. So I just want to have a brief discussion just about the implementation research that we're doing. As I said before, I'm working quite closely with Chief Investigator Professor Angela Martin and Kelly McInnes who's on this call. And we're working currently with 7 different organisations in Tasmania around this. So given the significant impact that implementing the ISO 45003 into your organisation will have, makes sense to take a scientific approach to implementation. And a scientific approach really focuses on filling the gap between knowing what to do and doing it. Now, in addition to the 7 medium to large size organisations in Tasmania that we're working with, and we're working with those organisations over the next 12 months, we're also planning to run a workshop where we're going to kind of provide a high level view of what we want to cover with those organisations over the next 12 months. So if you'd like to be involved in that, in the next slide, I'll provide my contact details and feel free to reach out to me because we want to get this awareness and knowledge raising as much as we possibly can. So the next graphic, even though the language is a bit more aimed at clinical studies, highlights what I mean by an evidence-based approach. So at Menzies, we're going to bring the best research evidence available to support implementation and work with key stakeholders in the organisation, so people that I mentioned before, those in work health and safety, HR, etc., otherwise known as the clinical expertise, as well as your workers, otherwise known as the patient values. And by bringing those 3 things together, as shown in the Venn diagram there, you're going to create an evidence-based approach to implementation. And this research is important not just because of the impact it will have on your organisations, it's going to help the research community understand and other organisations understand what are the barriers that could stand in the way of implementation that we need people to be aware of throughout this process as well. So I'll leave it there. These are my contact details. And if you're interested in learning more about the ISO 45003 or signing up to our workshop or receiving a copy of the white paper I mentioned, please reach out to me via the details on the screen.